If you get stiffness and soreness here, right in the very bottom of your low back, on one side or like a band all the way across the back, or you get sciatica with referred pain into your lower pelvis or thigh, strap in. Trigger points are areas of muscle stuck in a contracted state, and trigger points in your gluteal muscles are a very common cause of pain and tightness around the belt line and down the leg. So what causes the trigger points? Well, there's two main causes. One is simply overworking the muscles, running or bending or doing more exercise than you used to. Or two, restriction in the lumbar or pelvic joints. This can affect the glutes by nerve irritation or by simply restricting the pelvic joint so much that the glutes are overworked trying to move the pelvis. Either way, what I'm going to show you today should give you some instant relief in 2 quick steps. And actually, step number 1 is the way to tell whether you have trigger points in this area that's causing that stiffness and tightness. Step 1. Gluteus maximus and medius attach to the pelvis along the iliac crest, and the knots or trigger points that cause this type of pain and tightness tend to lie in this zone. To figure out if you've got this issue, you press into this area with a tennis ball while the muscles are in a relaxed position, moving over the area looking for very tender spots. If this causes a very intense ache, either locally or radiating a bit further down the pelvis or leg, that, my friend, is a trigger point. To release them, we want to maintain the pressure for about a minute. So to start off, find the knobbly parts of your pelvis, the PSIS. If you have a bit of trouble locating them, just bend forward a bit. We're going to check for knots in a line about 3 centimeters below the PSIS, working our way out. It's about where the top of the underpants would be in most people. Lie on your back on a hard surface with your legs bent. Put a tennis ball under the pelvis, just down and out from the PSIS, and then drop the knee on that side, out to the side, and relax it completely so that the glutes are completely soft. Then tilt your body over to that side to lay some weight over the tennis ball and move around looking for any sore points. Try to keep your shoulders facing the same direction as your pelvis. Sometimes it's too painful to lower your whole body weight onto these points because they hurt so much. So if they really drill, you can use the vertical leg to lift some of your body weight off the ball. Lay on each sore point for about 30 to 60 seconds, right on the most tender part, without moving. Just try to relax as much as you can. Often you'll find 3 to 5 trigger points about 1 centimeter or 2 apart. The pain can be quite intense, in the order of 6 to 8 out of 10 for pain, but it'll often ease a bit after about 20 or 30 seconds. You may find that all of a sudden you can put more weight onto the tennis ball. Work your way out along this line, doing each spot that you find. As you go out further onto the glute medius and minimus, move more onto your side. If you find tender points right out on the side of your pelvis, make sure that you don't put the ball on the bony point of your hip where your hip bone is. Keep a few centimeters above that because you don't want to put pressure on the bursa over the hip. If you've been getting a bit of sciatic pain, there's a good chance that this will help because these upper gluteal muscles refer pain down to the lower pelvis and thigh. But sciatica can also come from the piriformis muscle because the sciatic nerve that goes down your leg either goes through or directly under this muscle. To target the piriformis, just move down a bit to this area. If you get any numbness or tingling in your leg when you press in this area, just move to a spot a couple of centimeters further out. Step 2 is just a quick stretch of the glutes, but make sure you do this after the tennis ball release because else you won't be able to stretch out the whole muscle because part of it will still be contracted. There's quite a lot of variation in the shape and angle of pelvic bones, so different stretches work better for different people. I'll show you 3 or 4, and you can just use the one that feels like it stretches the most in the area that you just found those trigger points. Option 1. Probably the best is the sitting gluteal stretch because it works for a lot of people and it's really handy to do at work or at home without having to roll all over the floor. On a low chair, cross your leg and lean forward. But lean forward with your chest rather than just craning your head forward. You can lean in a few different directions to see what stretches the area we just worked on with the tennis ball. Do 2 stretches each side for 20 seconds once or twice a day. But don't overdo it because you can actually overstretch muscles and irritate them. You can do more time on the tennis ball if you want, but I'd avoid doing too much stretching, especially in the first few days. Option 2 for the stretches, still seated, lift the bent knee up and grab it with your forearm and then pull it in while looking behind you. Again, you're looking for a stretch of the muscles in the area you found the trigger points. Option 3. Face up, cross your leg and lift the bottom leg up. Hold below the knee if your knee is sore. For a different angle, simply try pulling your knee towards the opposite shoulder or elbow. If any of these positions pinch in the front of the hip, look for a different angle that doesn't pinch. If you just overwork the muscles in the last few days, you should get up and notice a big difference. If it's more of a chronic problem, you might need to work on it each day for several days to resolve it. But either way, you should get up and feel a nice change. If problems keep coming back in that area, you might need to go and see a chiropractor to release the lumbar or the pelvic joints. But you can also check out my video on low back pain relief for some ideas on mobilizing those joints yourself. Now obviously if you do have numbness or pins and needles or particularly weakness in the leg, you need to go and see a professional. But that's it for today. I hope you liked the video. If you did, give it a thumbs up, consider subscribing, comment below, and I'll see you on the next video. Cheers.